Time to ask the medical expert. We're welcoming back Brandon Kleemann with ChiroPro.
Good morning.
Hey.
Good morning. How are you?
Doing great. How are you guys?
Doing great.
Awesome.
Doing great.
So we talked about red light therapy last time.
Yeah.
Now let's talk about chiropractic care.
Yes, this is always going to be our absolute tip-top favorite.
Okay.
So a lot of people will ask, what exactly a chiropractor does. It's a very legitimate question. Our job as chiropractors is to focus on the diagnosing, the treatment, and prevention of what we call musculoskeletal disorders, which means your joints, two bones come together, make a motion. That's going to be your joint, nerve issues, muscle pains, tightnesses, restrictions, things like that.
Yeah, and there are different types of chiropractic care,
Oh yeah,
right?
definitely.
There's different classifications.
There's different classifications, there's different types of treatments. Chiropractic is fun in the sense that, you might go to this chiropractor, Dr. Joe down the street, and he might do this, and you might go to Dr. Jill down the street, and she might do something completely different, but it's all gonna be focused on the same thing, which is, making sure your musculoskeletal system is good, making sure you have good mobility, just making sure that you are as healthy as possible.
Brandon, what would you characterize a good chiropractic patient?
Okay, so we have this cute joke where we always say if you have a spine, you're going to be a good chiropractic patient.
Okay.
However, we live in a world where people very much believe that chiropractors are back doctors, and that's cool. I dig it. I spent a lot of time back there, but we actually more specifically are joint doctors. So people with joint pains, arthritis, sciatic pains, neck pain, mid back pain, low back pain, headaches, migraines are probably our favorite things to treat because they're quick and easy to do.
Wait, how do you treat that?
We do a lot of cervical adjusting, so neck adjusting, shoulder adjusting, stretching. But our job as chiropractors is not just treat the symptoms, but treat the root cause. So we're not just going to treat you because you have a headache. We're going to find out what's causing it, and we're going to spend time getting that taken care of, so you're not kind of chasing your own tail with the pain and things like that. So.
Yeah, and the idea is you're getting a broader picture. Different doctors focus on different things, and you guys are able to specialize right here.
Yeah, absolutely. In fact, in our offices, chiropractic is great. It is absolutely awesome, but we understand that like most medical professions, there's going to be a limitation to what we can do. So we open the office up, and that's why we talked about neuropathy the other day. We talked about doing red light therapy for aches and pains, post-surgical, pre-surgical type things. We'll also do things like acupuncture, dry needling, Graston, massage therapy, physiotherapy, the list goes on and on. We do a lot of things to make sure we clean up on the back end on anything that we can do.
What does a typical visit look like? If I go, I'm like, hey, you said anybody with a spine is a good chiropractic patient.
So if you came into the office today, you would do a $39 consultation. What this would be is you would come in, you'd sit down with one of the physicians, and you would just kind of talk with them about what's going on. We would treat you head to toe. We would talk about anything you wanted to, aches and pains, gut health, migraines, car accidents we unfortunately see, so what we do from there is determine if we want to take x-rays. We generally would. We do muscle scans, nerve scans, orthopedic examinations to really get a good idea of what's going on. And then you'll come back for what's called the report of findings. This is usually everyone's favorite appointment because this is where you get to learn about you. I always tell people, day one, I learn about you. Day two, you learn about you. So I'll show you your x-rays. We'll zoom in on all the cool stuff. You get to ask all the questions your heart desires. And then once you give us the green light, we get treated.
Okay, let's get into some questions.
I'm ready.
Let's do some misconceptions.
Yes, okay.
Chiropractic care is only for back pain.
Incorrect. So as I mentioned earlier, a lot of people will say that we are back doctors. And like I said, I do love it. You're going to spend a lot of time back there. Your spinal column, so all the bones that make up your spine, are protecting a very, very important organ called your spinal cord. This is what allows your body to do anything it wants. So, if we have tingling and burning, anything from visceral symptoms like heart palpitations, acid reflux, we can treat all of those things. A lot of people will say that, I'll just go to the chiropractor for neck pain or back pain. But if you've got sciatic pain, ankle pain, knee pain, hip pain, all those things we can treat.
Okay, let's do one more.
I'm ready.
Chiropractic adjustments are painful.
They are not. There's going to be times where if you've waited a long time, you have a swollen joint, there might be a little discomfort, but nothing that lasts more than a few minutes at a time. But what we do is very precise, it's very gentle, it's very specific. That's the biggest thing is specificity. When we do what's called when we manipulate the joint, essentially, we allow the pop to happen. That's going to be us lining everything up and making sure it feels nice. But there are some times where if we kind of push into you a little bit, you're going to be like, you're going to feel it a little, but every time someone lays down on the table like, oh my gosh, I'm so worried this is going to hurt, they get up and go, that was nothing like what I thought it was going to be. So it's awesome. I love getting to be the doctor to treat the patient for the first time. That way they look at me and go, "That's it?" I'm like, "Oh yeah, that's it." So it's good.
That's awesome. Yeah, chiropractic care. Don't think you have to live with that pain, that discomfort. You got an option,
Yes, sir.
and you might as well go and get this consultation
Yeah.
to find out.